Hey everyone, my name is Annette Bettis, and I will be going over my educational milestone assignment. In 2020, though daily numbers of COVID 19 cases continued to increase in many parts of the country, states began to implement their plans for reopening kinder through 12th grade schools this fall. While many major universities will offer primarily online classes for the fall semester, others still plan to provide in person instruction. So, I will be going over the reopening of schools beginning of 2020. COVID 19 has been considered the most significant threat since World War II and the greatest global health disaster of this century. From the beginning, looking at pandemic history, you can see that it started as early as year 165 and continues to the current 2024, ending with COVID 19. Many of which these were long for a couple years, some were prolonged for many years, and some, as you can see, HIV and AIDS, and even to today, COVID 19, are still ongoing pandemic crisis. Beginning with the history of COVID 19, in early December of 2019, COVID was identified as the pandemic and named by February 18, 2020. Several countries quickly implemented strict containment measures such as social distancing, school and business closures, excluding essential businesses, and home quarantine to reduce the transmission rates within communities nationwide. As a result, there's still a rising concern that the pandemic has taken a toll on the mental health of the general population. So, what is COVID 19? COVID 19 is an infectious disease caused by the severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV 2. Specifically, it causes various human respiratory tract infections, varying from mild cold to severe respiratory distress syndrome. Symptoms can range from mild cold like to more severe, leading to the spread of the epidemic. The COVID 19 virus spreads rapidly through droplets and particles released into the air, through breathing, talking, laughing, singing, coughing, or sneezing. From the beginning, California's governor issued the first statewide order in the United States that restricted the mobility to reduce the transmission of coronavirus, also known as COVID 19, on March 19, 2020, and it requires all residents to remain at home except when engaging in essential activities. With that, school closures began as early as spring break 2020. Schools sent out mass notifications of the closures of daycares, grade schools, colleges, universities. Within those times, children were affected. 21 million children in childcare were affected. 57 million kindergartners through grade 12 were affected. 20 million college and university students were affected. By mid-April, 192 countries had closed schools, affecting more than 90%, nearly 1.6 billion of the world's students. That following school year, 2020-2021, many schools started with virtual learning and ended the school year with in-person instruction with face mask requirements. By the end of May 11th, 2023, that marked the end of the federal COVID-19 Public Health Emergency Declaration. That declaration was given out by the World Health Organization. Statistics of those closures as of April 14th, 2024, the COVID-19 cases or coronavirus, the coronavirus total cases were 704,753,890 cases. The death toll was 7,010,681 individuals. And of those totals, recovered individuals, 675,619,811 individuals recovered. As you can see, those numbers were large in amounts, ranging from birth to infants to children to young adults to teenagers to adolescents to adults to the elderly. Those numbers include all the individuals. And now what's most important is looking at the reentry of those schools during COVID-19. The fall of 2020, as stated earlier, school districts reopened under varied instructional models. Some schools returned to in-person instruction, some operated remotely, and others reopened under hybrid models. From experience working in my school district, we finished the school year with virtual learning. The following year, we began with virtual learning. And by mid-semester, we invited students back, but left the option open to parents to keep them online or in person. As of May 19th, 2020, 58% of the world's student population was out of school, affecting 1,985,427 students. When schools began to reopen of that September 2020, 84% of students reported returning to in-person school, while only 11.9% remained in online learning at the end of the school year. June 29, 2021, most schools were reported to be in-person learning, yet some families did not send their children back to school, which left many students without education, without learning experience, without socialization, without communication, and left them in isolation at home. With those reentries of in-person school, the World Health Organization set guidelines for schools to follow, which was reported and sent out to every school to post on their walls, post on social media, send home flyers, so that families understood how to reduce the risk of COVID-19 transmissions. And they are as followed: to maintain a distance of at least 1 meter, keep hands clean using soap and water more than usual, wear a mask indoors and outdoors when physical distance is not possible. Every student was required to wear a mask at all times, except during lunch when they were eating, but once lunch was complete, students were asked to put their mask back on. Cover coughs and sneezes when not wearing a mask. Open windows and doors to ventilate classrooms and common areas. Those were more so for janitorial purposes. Beginning of school, end of school, windows were to remain open to help clean. Get vaccinated when it was your turn, especially for teachers. Some school districts required that they couldn't return to teaching without their vaccinations. And remember to stay home when not feeling well. Many school districts allotted time for sicknesses, allotted time for COVID-19 illnesses without being deducted. The impact that it had on students, teachers, parents were the increase of mental health traumas. Many were affected with anxiety, suicidal ideation, oppositional behaviors, PTSD, and depression. More specifically, in looking at children, these were affected more highly for those students who were quarantined longer, who didn't have the same needs or means as other people. We're looking at those in low socioeconomic compared to those in a higher, more diverse, more money driven than those in low socioeconomics, those who were struggling with food, those who were struggling to pay their bills. Those are the ones who are more highly affected. Looking at those with PTSD, those students and teachers look back at COVID-19 and struggle with trying to move forward. Those students returning to school struggled with behaviors, not knowing how to engage from being isolated for so long. Those struggling with anxiety struggled how to interact with individuals, how to interact with students. Depression alone affected those who felt that they didn't have a purpose after COVID-19. Statistics show that 1 in 6 people will experience depression through their lives, and that number increased during the COVID-19 pandemic and the re-entry and reopening of schools. In closing, the global nature of this health crisis, which has also become a social and economic crisis, indicates that a response that addresses all these dimensions is much needed. The COVID-19 lockdown has resulted in psychological distress and highlighted vulnerable groups such as those with mental health difficulties. The COVID-19 pandemic has disrupted daily lives for individuals across the lifespan. In closing, we're looking and seeing that in 2020, a pandemic broke out, affecting students, teachers, families, and with the reentries, it not only affected all of them and so much more. With their mental health, with their academics, students are more behind than ever in their academics. As we try to catch them up, they're also dealing with those mental health traumas that were seen during the COVID-19 pandemic, were affected, and now moving forward, many educators are trying to find ways to help them move forward. Many educators are trying to help close the gap. Many educators are trying to show students that even after a large pandemic, they still have a purpose. My references are as followed. Thank you.